So nice, gentle, soft belly. So we're gonna go halfway in between the ASIS and the belly button to find PSOAS. And just kind of sink down slowly. Oh, wait, I'll patch this, hang on. First, okay, so if we didn't have this history of injury, one of the ways that I figure out whether somebody needs PSOAS work, especially if they have complaints of low back pain, go ahead and pull your knee into your chest, just kind of gently. Good. Okay, so, and then Rebecca, if you can kind of, I'm going to do that again, and I want you to kind of pan or like show from like here to here. Okay, so go again. All right, so if I saw his low back lurch on the table, like he had to arch his back, that's a pretty good indicator that his body's compensating to try and still do that hip flexion, but there's kind of a misfire in the combination of muscles here. Or if this felt weak, or he said it hurt anywhere in here, like that's a really good indicator that we need to do some PSOAS work. So I'm gonna come back in through here. I usually do this just kind of over the sheet. I like having a little bit of grip. And then I'm gonna slowly sink down. And it can be tricky to find the right place, but PSOAS usually feels like this, just kind of like round muscle. All right, and then go ahead and bring your knee into your chest again. Okay, so I'm a little bit off. I was kind of more in abdominals. Go again one more time. All right, perfect. So I can feel that muscle move underneath my fingers and actively engage when he does hip flexion. So now, you feel that dull knife?
Yeah.
Okay. And it should get better as we go through these motions. So what I want you to do is keep your heel on the table and drag your heel down until your leg is straight. Good. And then drag your heel back up so your knee bends until you hit that bolster. Yep. And do 4 more of those. And we'll see how this feels. Let's see if it's starting to release. Usually it's like a very obvious release, like all of a sudden it's just a little melts like butter. There. Yeah. Do a couple more for good luck. And then go ahead and leave your leg straight. And then I want you to rotate your whole leg from the hip. So make your foot like a windshield wiper. Yep. No. Leave your leg on the table. Okay. And then so in and out. And that's a good point too. It's a lot easier if we just show people what we want and then they can imitate it. Words are hard. Yeah. So because PSOAS does a little bit of internal rotation, we also can do this way. That feel good?
Yep. Okay,
cool. So leave your leg there. I'll take a little break. I'm gonna slowly back out. Let my fingertips come back to life. Okay, then I'm gonna go after iliacus, and just because that's part of the whole hip flexion complex. All right, so let's bring this leg back up again. And then I'm gonna try, and so there's a ligament down here. Let's see if I can catch it. That one. So we don't want to be going after that. That's a ligament that's supposed to feel stringy. So I'm gonna come a little bit above that, and then so ASIS is right here. And then I'm just gonna kind of curl my fingertips in against the bone there. Your iliacus is grouchy. Does that feel pretty terrible?
A little bit, yeah.
Okay. It's like, yeah, whatever, dragon lady, try harder. You can't hurt me. Okay. Now, incorporate a little bit of movement. Okay, so we're just gonna go in and out. That just softened.
Yeah.
Yeah, cool. Okay. Now, I always like to retest to kind of see how it feels after the soft tissue work. Okay, go ahead and bring it in. Oh.
Yeah, way easier.
Yeah. Cool. Yeah, it was just like smooth. There was like no like, sometimes there's kind of like some ratcheting. You're like, okay, I can do it. But that was like smooth as butter. Awesome. Cool. Okay.